guys, welcome back to my channel. Today I wanted to do a quick video on 6 tips to survive your nursing clinical. The first tip, and this would seem like it would be common sense, but you'd be surprised. Be on time, if not early. Okay, my clinical rotations were required to be at least 15 minutes early. So if our shift started at 7, we needed to be there at 6:45. I would be there at 6:30. This gave me time to find parking, get into the hospital, get my things put away, and to find my preceptor. By the time I did all of that, it was around 6:45-ish. So then I was considered on time. Do not be late. You do not want to be known as the person who is always late. The second tip is to participate. Be active. You need to not just stand along the wall and watch your preceptor or watch everyone else do everything. You should speak up and ask to do things. During my clinical rotations at Western Governors University, we were allowed to do pretty much anything that we had been tested on up until that point. So this included starting IVs, administering meds. I inserted Foleys, NG tubes, cleaned wounds. I did basically everything. So don't be afraid to ask to do something. Tip 3, speak up and ask questions. I cannot stress this enough. If there is something going on, like a medication being administered or a procedure happening that you don't quite understand, do not be afraid to ask questions. And if it's not the appropriate time to ask the question, remember your question and ask it later. That really helped me a lot with learning my meds, because that was one of the struggles for me initially. Every time we would give a medication, I'd make note of it. I had this tablet. This tablet fit into my scrub pants, and I would write down questions or the medications and things like that. And later on, when we had free time, I would follow up with my preceptor and ask her all the questions that I had about the things that we did that day. That helped me so much. I got this from Dollar General, and it was like $150 or something like. Tip 4, wear comfortable shoes. This is so important because our clinical rotations were 12-hour shifts. 12 hours. So it's like we're working a regular shift. And if you do not have comfortable shoes, your feet will hurt. They will hurt, especially if you're not used to being up on your feet that much. I know that a lot of nurses wear like those Dansko shoes. I don't know how to pronounce it. But I didn't buy any expensive shoes for my rotations, but I did get comfortable shoes. And these are dirty, so don't laugh at me. These are the shoes that I wore. Oh, they're probably so dirty. Oh my God. These are the shoes that I wore during my rotation. I got these from Walmart, and they were $10, under $10. They're very lightweight, and I didn't buy these with the intention of using them for a long time, but because they were so comfortable, I kept using them. These shoes are soft, but they made my feet feel good because they were so lightweight and soft, but you might not be able to wear this type of material for your rotations. It's like I don't know. So just make sure that you check with your program to see what type of shoes you guys are allowed to wear. Because I know some programs you have to wear like hard top shoes or whatever. But those shoes were great for me. They were. Tip 5 is you need to dress professionally and neat. And again, this seems like something that would be common sense, but you really need to pay attention to the way that you dress for your clinical rotations. And our school and most nursing schools, they have a guideline as to how you're allowed to dress for your clinical rotation. Our hair was required to be back in a ponytail or a bun. It had to be up off of our shoulders. We were not allowed to wear these. This is a no-no, but I'm not working right now, so I can wear my nails however I want to. But we couldn't have any nails on, and this includes no polish, nothing on your nails. We had to wear our assigned scrubs. They're really big on that, so make sure your scrubs are clean, make sure they are wrinkle free. If our clinical coordinator, if she was at the hospital that day, if you had like the slightest wrinkle or something in your scrubs, she would point it out to you. So your scrubs need to be clean, free of wrinkles. Your shoes need to be clean. Just make sure you're neat. Tip 6 is to take care of yourself. This includes, remember to eat. Like I said, we had 12-hour shifts. We had a 30-minute break to eat. We had a 30-minute break to eat our food or whatever. Take that break, go and eat your food. And if you don't want to eat like a full meal or whatever, just remember to bring healthy snacks with you. Like not snacks with a bunch of sugar and things like that. Because that can give you like a sugar rush and then you crash and you get all sleepy, you don't want to finish your shift. So I had like little Ziploc baggies filled with mixed nuts and almonds, and I had like some celery sticks and those single serve peanut butter cup things. Those things are really good. Another part of the take care of yourself tip is to drink water. You'll be surprised when you get to the hospital and do your shift or whatever, you'll just be on go mode the entire time and forget to drink. I had some days where I would do that. I recommend bringing with you a reusable water bottle, you know, like I don't know, my water bottle, don't laugh at my example. My water bottle was like about this size. It was reusable, you know, it had a little flip top on it. And then at the nurse's station, they had like a little water fountain thing where you could refill your bottles and things like that. But those things, they saved my life, guys, because I used to get so thirsty doing all that ripping and running around. So remember, drink your water. And the last thing, make time to go to the bathroom. Our preceptors were really good about this. They would actually remind us, because they would constantly tell us like how bad it is to, if you have to use the bathroom, to hold it. So they're really good about reminding us to do that. But anyway, those are my 6 tips to get through your clinical rotations. They helped me a lot. I hope they help you guys. Remember to click the like button and subscribe. And if you guys have any questions, leave them down in the comments below and I'll be sure to answer them. Until my next video, have a great day.